Are there board members with questions? Yes, Ms. Hughey.
Why doesn't Texas apply for a waiver? If it's good enough for everybody else.
I was at the lead staff for Texas School Alliance, and some of the superintendents who are officers met with the governor asking that question, and the governor said the waiver would eliminate school choice, and he supports school choice, so he does not see why he would sign that waiver. So the federal government is considering circumventing the governor's office next year and going straight to districts. That's conversation. It's not happened yet. And perhaps individual districts within the state could apply for the waiver.
So there is not a concern at all for what this does to our children and by that our districts? I mean, there's no concern in the governor's office?
Ms. Hughey and the rest of the board, as you know, for several years now, we've been trying to get the governor to apply for a waiver from this AYP system. We are swimming up a stream without a paddle, trying to get the leadership at the state capitol. We're now in between commissioners at the time. It speaks volumes about where our state leadership is at the Capitol, that 33 states have already applied and been granted a waiver, and 5 more are already in that process and will be getting that waiver, and our leadership continues to say that they're not even going to submit the waiver. And I know I keep simplifying what I'm really trying to say, but the bottom line is no, they don't know how difficult these sanctions are to school districts. And trust me, we're not alone. In fact, we're just one of hundreds of school districts that are battling this stage 1 issue. And we're getting ready to go to 6 schools in the next week. Tomorrow night, Wednesday night, Thursday night, and I think we have one more next Tuesday night, where we will go to the communities of each one of those schools and offer those parents school choice to one of 2 other schools, just like we did last summer. But what's incredibly difficult, we're surrounded by AYP. We immerse ourselves in this every day. So it becomes very difficult at a 1-hour meeting or at a 2-hour meeting in the school cafeteria to try and convince the community that our schools are doing very well. The frustrating part is that our schools have done well on the state accountability system, but yet don't meet AYP. I'm kind of talking a lot right now, I know that, but it is very frustrating for our staff because we know that learning is going on. We know that our kids are doing well, but we have an uphill battle. I have to tell you, in the next week, and we'll be getting you some information as to the whole idea of school choice, transportation. It's frustrating, but I can tell you that one of the things that I asked Jana to ask the leadership of the Texas School Alliance the other day is it needs to be one of our main agendas as we move forward with the legislative session, because it becomes incredibly difficult to try and convince our communities and convince our districts that instruction is moving in the right direction at the same time that we constantly keep getting pounded by the accountability system, both state and federal.
Well, and to add to that frustration, they've crippled us financially. They've gutted us financially. This isn't cheap. This only adds to the financial burden that we're already facing.
If there's any silver lining to this whatsoever, and I'm not saying that it's a silver lining, but this is exactly the root of our lawsuit. This is exactly the root of what David Thompson is trying to do in our lawsuit against the state is to prove that at the same time accountability is ratcheting way up, you are reducing funds to the Northeast School District of some $70 million over 2 years. So you can't have it both ways. You can't keep measuring how well we're doing in the classroom at the same time that you're reducing our revenue, not just a little bit, but a lot. So,
Because I have a feeling they're probably not stepping up to pay for that additional transportation that they're
Oh, no.
requiring to these other
No.
schools, right?
no,
Right, yeah.
that's all local money. You know, not only is it going to be a financial burden on the school district, but I can tell you from the operation end of it, Nolan Anderson and his staff at Transportation's got their work cut out for them when we start giving school choice to 6 additional schools that have an opportunity to go to 12 different schools with transportation at the same time that you have to sit and tell parents that are at that school who are not receiving transportation services because they may be under 2 miles or they don't live in a hazardous area. So you see the complications and the frustrations that we have with the whole program.
What happens in the next couple of years where, sadly, and we're not alone in this, but more and more schools, eventually, all of them, basically will be on this list, and so either there's no place to go, correct? Or if schools are capped, there's no room to move students into. So basically, does the whole thing just sort of go away? I mean, I don't understand.
I'm going to ask Jana to help me out with this one, but before I turn it over to Jana, I can remember last summer being one of my first board meetings as a superintendent. Still, I was the interim superintendent at the time, and having to tell you that in 2014, which is only 2
Yep.
very short years from now, we will not have any schools that will meet AYP. And here we are, we're just 2 years away from it.
Right.
Jana, Mike, Jeff, what happens in 2014?
Well, the sanctions, the Stage 1, Stage 2 through Stage 5 only are applied to our Title I campuses. About 50% of our campuses are not Title I, which means even if they haven't met AYP as much as our titles, they are still eligible. They'll be the receiving schools for our AYP school choice, even though they have not met AYP either.
Wow. I'm sorry. That's the craziest thing.
If you would keep in mind, too, that for the state of Texas, there was a 580% increase in the number of campuses that did not meet AYP this year.
Right.
Well, is that going to wake them up?
You know, if we could just get Congress to reauthorize ESEA, if we could get them to talk about it, you know, maybe those kind of numbers will wake them up. I'm a little skeptical. I think Congress and Washington have a little bit of other things on their mind right now with a very important election coming up in November. Everything that we're hearing, they will not reauthorize Elementary and Secondary Education Act anytime soon. So, Brigitte, I would think that these kind of numbers would wake them up. But remember, we're dealing with a group of legislators, and I'm trying not to define all of them, but there is a growing number of legislators, both at the state and federal level, who don't believe in public education. And that's the scary part, is if they don't believe in public education, then we're not going to wake them up. They don't want to be woken.
That's true. And the other issue with ESEA is it's still being funded at 2006 levels, is that right? It was the last time it was authorized, I think it was 2006.
I think that's right.
And so we're 6 years behind in the increases that we should have gotten, and even in 2006, they weren't funding it at 100%. So it just continues to be a really bad story. Mr. White?
Madam Chair, I
I want to echo what Dr. Gottardy just mentioned. There are individuals, and this program was written in a way that was where a school district would fail. I mean, that was obvious from the beginning. And the case in point is the participation rate. If a student is sick today and missed a test, then there's no makeup, you know. So all of those types of things was written into the law to set it up where we would fail. Public schools would fail because they didn't. There are certain individuals that don't particularly care for public schools to exist as we exist today. So again, we've seen the handwriting on the wall all along, and it's not that we are not doing a good job, but to the community, when they say we don't meet standards, but the standards are set at a point where it's impossible to reach unless you had additional monies and what have you. And as you know, the state fund cuts in the last several years has caused us in Northeast Independent School District to have to go from AB schedules and things of that nature, but we still have to do more with less and educate students to a higher level. So anyway, what's going on now in terms of schools across the country not meeting AYP, so to speak, is a consequence that some people wanted to happen in the first place. So we, again, have to continue to do the best we can in educating our students. And while I do have a question to staff. The stage one last year at the one school, Stall, I think it was. Do you know how many people chose to move to other schools?
Yes, sir, we do. Mike, 25, 29?
Yeah, it's just right at 30. And what I do know, we were at the meetings last year, and most of those folks, in fact, well over the majority of them, chose to move not because of the school, but simply because they felt that the Redland Oaks, which is the school of choice, was a closer to where they live, and it had nothing to do with the school.
Okay, thank you.
I have a question. Given what we've talked about, given the changes that have come in, how much money is this going to cost us year to year trying to move forward, and how much should we budget for?
Well, the set aside from our Title I federal funds is 20%, so that's $2.3 million that we're setting aside this year to cover transportation costs and any other costs associated with being in stage 1 and 2. So it does come out of our federal allotment, but 2% this year, and we hope not to use that entire amount, but the majority of it will federal go for transportation. Another consequence of this, as students switch schools, it could impact staffing. We'll know in about a week or 2 weeks what it's going to do in staffing. Can we shift staff? Will we have to hire more staff to accommodate the students? And that's the unknown right now of the cost.
Okay, so no guess from last year to this year?
No, last year the transportation was paid by federal money, and no staffing changes were needed for 31 students.
This year we're waiting on.
This year we'd
wait to find out on this year.
We'll know in the next week to 10 days, because like I said, we start our community meetings tomorrow night. They end next Tuesday night. We'll know by the end of the following week how many students want to move. The big part, not only is transportation a huge cost, but more expensive than that is this idea that Janet just brought up, is the idea that a week from now or a week and a half from now, we very well may have to move staff. Because if we don't move staff, we'll have to hire additional staff. And that's, moving staff is not necessarily a cost, but it is a huge morale buster 3 or 4 days before school starts, where a teacher gets a call and says, by the way, you were supposed to report here, we need you to report to this other place. Now, hopefully that won't happen very much, but we're prepared to do that because of the costs involved at $60,000 a pop for a teacher. So our staffing committee is actually meeting, I think, is it this week, starting this week?
The 21st we'll meet as soon as we get in the paperwork, the first round of paperwork on school choice.
What's the total population of the 7 schools? Is it 7?
The total population of the 7 schools?
What's the potential impact? What's our total that could?
Well, if, let's say Nimitz has 1,000 students, all 1,000 students have the option for school choice. So if you take 1,000 times 7, it could be shifting 7,000 students.
Huge compared to last year.
It has the potential to be used. We do believe, we don't know. I
Right.
won't, I'm not going to speculate yet.
Yeah. But 25 is the total of the stall population. It's somewhat promising if you look at it statistically.
Yes.
We have.
But you don't know, I agree. Yeah.
And it's really the unknown. We really don't have a magic 8 ball.
Sure.
We have had meeting after meeting after meeting with our principals, because as these community meetings start tomorrow night, we have always felt like it needs to be the school principal who's up in front of that community, convincing them, here are your options, no doubt, this by law, here are your options, but we truly believe that the right place for your child is at their current school. And we did that last year, and we only had 31 takers who wanted to leave their school of attendance and move. So, now we didn't have middle school last summer, we have 3 middle schools this summer.
Right.
But all these schools are either recognized or academically acceptable, correct?
That's correct.
So that's the confusing part, but also that's the redeeming part, because if the principals capitalize on the ratings, the state ratings, then I think that will communicate a better picture of what's actually going on. But it's going to be a challenge for sure.
I feel like I have to say one other thing. And I told several reporters this last week. We take all accountability results very seriously.
Sure.
We were waiting for days for these results to come out. But you knew a year ago that we knew this July, we had our doubt.
Yeah.
But what we strive for the very best instruction in every classroom in this district. And we take all results on accountability very seriously. We now know what we're up against. We have to deal with it. We have to move forward. And that's what the staff has prepared our principals and our schools to do. So hopefully by the September board meeting, we will give you a report on what exactly has transpired since this board meeting with AYP.
Madam Chair, I have one question.
Sure.
Could you go back to the slide with the campuses that met AYP? So when I look at that slide, I look for commonalities. Tell me what it is about these schools that gave them the ability to meet AYP versus the ones that were not.
I don't know if there's one commonality among all of them. Some of them have small student groups.
Okay.
If you don't have 50 students in a qualifying student population, that student group doesn't count.
So that's a metrics issue that we cannot.
That's right. So
Control.
some had fewer cells that really counted at their campus than others. I think it's obviously more difficult for Title I schools because they have a more at-risk population, and so we're very proud of the 4 Title I schools that made it, but I think that's a commonality. And then I think it could have been, we have 2 schools that missed it by, I think, one by 2 students and one by 3. If you have a student group that qualifies, but it's a very small student group, 1 or 2 students can determine your rating for you.
How many Title I schools do we have? 37?
42.
42. Okay.
28.
28. So it's decreased.
He went like that.
28? Really?
28.
Okay, I thought it was in the 30s a few years ago when we were in Washington.
No, this is the most we've ever had
Okay,
this year.
28. You know, it gets to the point where I think we need to, how can we play the game? How can we maximize? Because unfortunately, I don't disagree
No,
with
you
what
can't.
anybody has said. And I remember being at a school with my child when we had not met AYP, and Dr. Thomas had to come and plead with the parents so that we wouldn't all revolt. So I've been there as a parent, and I remember, and that was the first, I think, when this happened. But the reality is that we have a standard by which we are required to meet, and the population, the general population, sees that as success or failure. Yeah, rightly or wrongly, exactly. And it's hard to extract data and information like one cell or one child unless you're really, but so anyway, can we replicate some of these successes so that the numbers increase, even though we know we're doing our job? Does that make sense?
It's instructional practice. It's good quality core instruction. It's very targeted intervention with individual students targeting to the areas where they're slipping, and then it's progress monitoring. If you have a student who's struggling, I think we try the interventions, we monitor them, we adjust. So I think it keeps going back to, and I told the campuses, the hard work is in every classroom every day, by every teacher every day. They have a tough job to help every student every day get across the mark.
Because the counter's going to be, well, look, you had 3 high schools that passed, why can't you have 7? I mean, you can hear the argument, you can hear the counter, and the counterpoint is by those that are making huge decisions on behalf of 5 million kids in the state of Texas. So I almost feel like, what can we do, and I don't know, so that that number increases, because obviously schools can pass AYP.
Well, it won't increase because next year the
Well,
standards
but-
go up, and then the next year it's perfection, and so it's
You
a
have
losing
to be
battle.
very careful to compare these schools versus the failure list of schools. Jen has already mentioned, because you had some schools who didn't meet AYP by 1 student.
Right.
So 6 of their subgroups did very well, but 1 subgroup failed by 1 or 3. I think we have 1 school failed by 3 children. So now that entire school has this label that they didn't meet AYP, and it could very well have been because of 3 special education students. Or it could have been 3 LEP students.
So really, you can't do it then? Is that what you?
We continue to strive to do what we can to make those standards. But like Ms. Galindo just said, now they're going up
Well,
7
they're
more or
ramping
6
up.
more
I
percentage
understand.
points in reading, and I think 8 in math.
I think it's 11.
Trying to,
9.
is there a creative way? I guess not.
Is there what?
A creative way without cheating?
I don't think you can game the system when
That's
it's.
basically what I'm asking,
No.
because they're trying to game us.
Because the standard has increased
I
so
mean, fairly.
rapidly.
I'm not trying to, I don't know, it's just very frustrating.
Well, and to add to that frustration, to have 87% or 90, or even 92 or 93% of the regular population, that's what you guys pay us for. They should be meeting those standards. But when you have that kind of target on the sub-pops, that's just not fair, that you hold a special education child or a limited English proficient child to those kind of standards. Those, you talk about the games, those are the games that we can't play.
Okay, one more thing, you just prompted a thought. What about when in your, not your sub-pops, but just the way it's broken out by ethnicity, and there is a disparity in those numbers. I'm sure you've got a strategy for that.
There are gaps between the ethnic
Yes.
groups. We talked about it at leadership last week. We looked at them, and it's different campus by campus. We have closed the gaps through tax, but when you move from a tax test to a STAR test, it's a much more rigorous test. The gaps will widen again, because
Okay.
what you do, you push students to meet standard, and as more students top out at the tax test, you're going to have less of that. So we're going to go through a period where the gaps will widen with this more rigorous test, and then as we get more
Narrow.
proficient and understand the test, see the test, know what we're teaching to, we'll start to close the gaps again.
I accept that answer. Thank you.
Are there any more questions?
So just a comment, and I see this system as very cruel and insensitive to our children, and I am constantly in awe of the incredible job that this staff and our teachers, the more they're dumped on, they still continue to rise and face the challenge.
Yep.
It's just amazing to me, and it's something to be so proud of. And I wish that's the story that we could get out. That no matter how they try to break you, and they are trying, that you still continue to put our children first. And for that, we have to be grateful.
They're trying, but they're not going to break us.
Mr. Wheat?
Just real briefly, as somebody with 2 kids who will be in middle school in a Title I school, I'm fine with them being in the school. I don't have a problem with it. I understand the numbers. But what I will want to hear from the staff, and what I think the community will want to hear, is where are you working on it? What are the changes that you're going to make? And we've seen the numbers that are going up and then slowing down a little bit. And, they may not always go up, but I think that parents with kids in a school like that are going to want to know, what is it that we're going to do?
I agree with that statement, and part of the presentations that we will be giving next, starting tomorrow, every campus principal has their commitment statement and what they will do at their campus to address it. In addition, at the district level, we will benchmark, we'll monitor every campus, and we'll monitor it by student population and by teacher performance, and we will help and support them as they meet this challenge.
Thank you.
Anyone else? Thank you, Mike and Jeff, for that presentation.
Madam Chair, I just
Yes.
have one other comment, in that that is to say that we, as Northeast Independent School District, definitely continue to provide a quality education, and as do most other school districts throughout the state and throughout the country. There may be a few that really are not doing a good job. But the evidence that it's something wrong with this system is that all school districts are failing it. So it just doesn't meet the average standard of any type of system of evaluation if every school district in the state fails it. Then there's something wrong with the measurement.
For sure.
So we know that, but at the same time, we continue to provide quality education, which we, have to continue to do, even though the system is not fair and equal. That's all I had to say. We can't take pride in the fact that we are missing the AYP, but we can take pride in the fact that nobody else is making it.
Thank you, Mr. White.
Thank you.
Next item.
D, gifted and talented compliance.
Ms. Hawkins.
Thank you, President Galindo, board members, and Dr. Gottardy. The Texas Education Agency asks us every year to report to the board if our gifted and talented program is in compliance, and our program is in compliance. All GT teachers have the required 30 hours of GT certification. They've completed their annual 6-hour update training. All GT teachers have held the parent meetings to relate program requirements and expectations, and all new district principals, assistant principals, and counselors have received the 6 hours of GT training. I'd like to recognize Kay Stotts. Please stand, Kay, our coordinator of our GT program, who monitors and makes sure that we always stay in compliance.
Thank you. Next item.
E, other.
And I don't think we have anything under other. Next item.
8, board business. A, possible action regarding 2012 TASB delegate and alternate.
Yay, it's that fun time of the year where we get to nominate a delegate and an alternate to represent us at the TASB conference in September. And last year, it was Ms. Bresnahan, and Mr. Bristow represented us well. I don't know if anybody wants to say anything about what goes on, but typically, we vote for a board member who's not present. And everybody's here tonight, so it won't be as much fun. So do I have, would somebody like to nominate someone to be our delegate?
Madam
Our
Chair.
volunteer to be the delegate? Yes,
Well,
Mr. White.
okay, since you volunteered to be the delegate, well, what I was...
No, I didn't.
Oh, I thought you did.
No, I said, do we have a volunteer?
Oh.
Would you like to volunteer?
No, I have a comment,
spoke
though.
first.
We do have 2 board members that haven't been to the convention yet.
Right.
And it would be good if they could go.
Yeah.
And it's sort of a common practice across the state for the rookies to be delegates. Or the absentee. But it is a good way to understand the operation of the school district throughout the state by going and being a delegate to actually understand the
process.
TASB, how TASB, Texas Association of School Boards, how the Texas Association of School Board operate. So I'm not going to nominate a Jim
Or
or
Shannon.
Ms. Shannon, but maybe they would like to volunteer just to be.
Now that you put them on the spot, Mr.
To get their
White.
feet wet, I can assure them that it's not something that
It's
you
very
can't
interesting.
do,
It's an interesting process.
and it'll be a
Really
good
is.
learning process.
Mhm,
So
agreed.
that's-
Since I've been to the last 2 meetings,
Yes.
Mr. White, it'd be an honor.
Thank you. Shannon, would you like to be the alternate in case for some reason?
I was really hoping to be in Hawaii.
Weren't we all? So,
Okay.
okay, great.
Thank you.
Thank you.
But if I'm in Hawaii, can I send somebody else in my place?
Yes, if you are in Hawaii, one of us will go in your place in case Mr. Wheat decides to go to Hawaii or somewhere else as well. All right, so
I think we'll all be there anyway.
yeah.
So we need a motion.
So I need a motion to move this forward.
I move that we approve the nomination of Mr. Weed as our delegate for TASB conference.
Second.
Okay, I have a nomination and a second. Anybody, any more discussion? All right, all those in favor say aye.
Aye.
Opposed? Motion carries. Congratulations, Mr. Wheat. And now I need a motion on an alternate.
Go, Lou.
Well, I move that we nominate Shannon to be the alternate.
Do I have a second? Second by Ms. Bresnahan. Any other discussion? All those in favor say aye.
Aye.
Opposed? Motion carries. Congratulations. We'll look forward to hearing all the things that y'all learned.
They'll send you a package.
Yeah, they'll send you a nice juicy packet that has lots of pages in it. No, it's really a good process, and we've all done it, and are better for it. It
I'll
really
be
is.
there.
Yep.
I'll be there.
Yes.
Too, so.
Sandy's on the board and will be there, so you can have a familiar face when you go.
Too bad I can't just be the delegate. Yeah.
All right. Next item.
9, new business for possible board action. A, board policy. 1, possible action regarding board policy EI local, second reading.
Ms. Hawkins.
Thank you, President Galindo, board members, and Dr. Gottardy. We are bringing the second reading of EI local to you tonight for your approval. And if you have any questions on the policy, we're prepared to answer them.
All right. Are there any questions? Okay, seeing none.
Madam Chair,
Oh, yes, Mr. White.
I move that we approve the second reading of the update
A policy EI local.
policy EI local. Thank you.
All right, thank you. Do I have a second? Second. Thank you. I have a motion and a second. Is there any discussion? Nope. All those in favor say aye.
Aye. Aye.
Opposed? Motion carries. Next item.
B, human resources. 1, possible action regarding approval of PDOS appraisers.
Dr. Scheffler.
Madam President, members of the board, Dr. Gottardy, once again, we're before you like each year. State law under the Education Code requires that all teachers be appraised by certified appraisers. Those on the list that you have all received the appropriate training. And I just want to stipulate that the law states that the list of qualified appraisers who may appraise a teacher shall be approved by the board, and all requirements have been met. So it's recommended that the board trustees approve the PDS appraisers for the 2012-2013 school year.
Thank you. Do I have a motion?
So moved.
I have a motion to approve the list of PDOS appraisers for the 2013 school year. Do I have a second? Thank you, Ms. Bresnahan. Motion and a second. Any discussion, questions? All those in favor say aye.
Aye.
Opposed? Motion carries. Next item.
C, instruction. 1, possible action regarding 2012-2013 campus instructional improvement plans.
Ms. Hawkins.
Thank you, Madam President, board members, and Dr. Gottardy. I'd like to invite Terry Chidgey, our Executive Director for School Improvement, to present our 2012-2013 campus instructional improvement plans for your approval.
Good evening, Madam President.
Good evening.
Members of the board, Dr. Gottardy, executive staff, and guests. The Texas Code of Education 11.251 requires that each school year, the principal of each campus, with the assistance of the campus level committee, shall develop, review, and revise campus improvement plans. The purpose of the campus level plan is to improve student performance for all student populations, including students in special education programs under Education Code Chapter 29, Subchapter A, with respect to the student achievement indicators and any other appropriate performance measures for special needs populations. Each campus improvement plan must assess the academic achievement for each student in the school using the Student Achievement Indicator System, identify how the campus goals will be met for each student, determine the resources needed to implement the plan, identify staff needed to implement the plan, set timelines for reaching the goals, measure progress to ensure that the plan is resulting in academic improvement, provide for a program to encourage parental involvement at the campus, include goals and methods for violence prevention and intervention on campus. If the campus is an elementary, middle, or junior high school, set goals and objectives for a coordinated health program. I'm going to ask Michael Laura at this time to navigate our way through the district webpage to locate. We're going to go to Regency's campus plan, so I'll turn over to Mike for just a second as we find it.
The first portion, you just find school listing. Then at that point, you just find the particular school you're looking for. Let's go to Regency. And what you find is what's called a splash page, which is very common format that's used for every single school. And toward the bottom right-hand corner, you'll find something called Campus Plan. Select the year, go back to Regency. And I'll let Terry take it over from here. Tell me.
Okay. So the first page includes the board goals, and if you keep scrolling down, and up just a little, and the district goal. So then down. At the top of every page, you have the things that are required that I just listed, the board goals, and we check to be sure that every campus plan includes every single board goal. A targeted area, and that's determined by the campus. Every campus has an individual plan that meets their needs and what they have determined by their CIC to be the important goals, targeted areas. And then there's the performance objective / strategy. So what it is we want to accomplish and then how we're going to accomplish that. And then the evaluation indicator, and that has to be something that is measurable. The timeline, responsible persons, and then cost and resources. So I purposefully chose Regency, not only because it's excellent and the principal was going to be here tonight, but I also would like for you to scroll down and just make note that if you're a title campus, the last 10 targeted areas or goals have to address the Title I components. So Title I Component 1 is needs assessment. Title I Component 2 is school-wide reform. So on down to 10. So those are at the end. So title campus plans are just slightly different. And some of the things that you would include in a campus plan, for instance, parent involvement, that's component 6. So you would just put that in. So it is recommended that the Board of Trustees approve the Northeast ISD Campus Instructional Improvement Plans for 2012, 2013 as presented. Thank you. Are there any questions? Oh, sorry, Ms. Bresnahan has a question.
Actually, Ms. Chidgey, could I ask the principal, did you say the principal is here? She is. I'd love to ask her to come up to the microphone.
Smith Janet Bielma,
Ms. Janet Bielma.
Principal of Regency Place Elementary School.
Good evening.
So could you take me through, I'm very intrigued with plans, I like them, and I like matrices. So you are the principal and you've got this campus improvement or instructional plan, and you have indicators. So how do you follow those indicators? For example, the first one said 100% is going to pass such and such. Take me through the process.
Well, first of all, the Campus Improvement Committee meets monthly
Right.
at our campus. And we look at each area to make sure that we're meeting it. But in between those monthly meetings, I also have data coaching. Well, they're not data coaching. It's data instructional rounds that we look at. I meet with each grade level, specifically after we have benchmarks, because we want to see how our children did. Then we do targeted intervention. At Regency, we do school-wide targeted intervention in the morning, and we do that for reading. And then a little bit later in the year, we could possibly do that for math also, depending on how the student is doing. So it's not necessarily reading specifically, but it's mostly reading. After we've looked at each benchmark and we look at each child, we put each child on a list of children that are not doing particularly well in an area, and each of those teachers has to tell me exactly what they're doing to meet those needs. Sometimes a child needs we call them a double dipper. So sometimes we have a child that needs help in reading and in math. That's when my instructional coaches, my PE music teacher has helped with some areas that we get extra people to come and help that child too. So they not only get school-wide intervention during the day, and then they get intervention while they are also in, let's say, a reading group. They have also an additional targeted intervention after school during tutoring.
Okay. And so in doing all of that, then you reassess and monitor the intervention. Report back to the CIC committee. So you're using this all the time?
All the time.
I mean, this to me would be pasted on my board, right, Bob? Yep, that kind of thing. And be just full of paper, full of marks.
And when a teacher comes and she opens her data notebook with me, if I ask a question about a specific child, she has to be able to answer whatever question I ask.
So this plan, this tool, you're keeping up with the indicators.
Correct. Like, we may end up changing the money amount.
Right.
We may end up changing the goal to add something in there that we've seen. We're going to have a meeting with, at Regency.
Uh-huh.
We did not make AYP because of our math area. And so I've already talked to my math instructional coach today, as a matter of fact. She came back on contract today. And we're going to be meeting with the math people to see how we're going to do even drill deeper down into our targeted intervention.
And do you ever come out with a final report with all the outcomes in all these cells? So the last column would be met, indicators were met, or this is what was done in order.
Well, mine is all written up.
So you do have like a final report?
Mm-hmm. Do we? It's an ongoing thing.
Yeah,
so
yeah. It's like a living.
Never
it is a
does
living
Ms.
document.
Right. Never does Ms. Hawkins ever say, "Give us a final report on it," because we're never done. We're constantly, because 100% won't. And if I have a teacher say, "Well, 100% of my children aren't going to do that," I would say, "Well, then point out which ones that aren't."
Yeah. You said 100. So what percentage did you meet?
Right.
And why didn't you meet it? And what was it that?
Right.
And then you
Because-
use that as a tool for the following year.
Yes, ma'am.
So
Because this year we had to change it even more because of not meeting AYP.
You answered it. Thank you very
You're
much.
very welcome.
Thank you for your hard work and your love for the students. It comes across very well. Thank you.
Thank you.
Any other questions? Do I have a motion?
I move that we accept the campus improvement plan as presented.
Do I have a second?
Second.
Thank you. Who was that? Was Shannon, was that you? Okay. Have a motion and a second. Any other discussion or questions? All those in favor say aye.
Aye.
Opposed? Motion carries. Next item.
D, Business Services. 1, possible action regarding bid item for third-party administrative services for district self-funded medical and RX plans.
That would be Mr. Villarreal.
Yes, Madam President, members of the board, Dr. Gottardy, executive staff, and guests. I have Steve Tovar, our Senior Director of Employee Benefits and Risk Management. We're going to go over the details of our medical bid that we put out. He's going to give you some information on it.
Thank you, Dan. The last time we met was in May during the budget study session. We had a historical event occur after we met in May. The Supreme Court upheld the Affordable Care Act in June. Now, carriers and employers will have to continue to move forward with implementing the changes from the Affordable Care Act. However, if you listen to the news, it may not be over. We've got elections that are coming up, and there have been promises that there would be changes. But as it is today, employers and insurance carriers will have to just move forward. The good news is that there are not a lot of changes in 2013 as far as the Affordable Care Act is concerned for us. One of the major changes is a limit on flex spending for our employees. It'll be a $2,500 limit. Currently, we let them put $3,000 into their flex spending, so it'll be about $500 less, and that's the major change for 2013. 2014 is when I guess all the argument has occurred on the Affordable Care Act and the mandate, and that's when that should take effect.
All right.
Enrollment, this is, we saw most of these slides. I condensed them down. I told Dan I wouldn't take too long. I'd try and run through them really quick. But we have a couple of new members, and so I'm not sure if they got to see these. The enrollment on our health plan is down 143, but we are carrying more dependents. The employee numbers being down, I think, coincides with the district austerity program. We're not hiring as many employees as we used to.
Okay.
This slide is just a representation of historical contribution rate. Basically, the district contributes about 2/3 of the funding, where the employees contribute about 1/3 of the funding for the health plan. This is a comparison of our 2012 low option PPO rates compared to our neighboring districts. Our employees currently at 2012 pay $77. In the neighboring districts, it's $93 and $216. For family coverage, ours is $347, and theirs is $528 and $989.
Big difference.
This slide is, these aren't employee rates, this is the total premium, and it's a comparison to the TRS Active Care. There's 1,100 school districts in the state of Texas. 1,000 of them are on the TRS Active Care plan. And so this is just a comparison to Active Care 2, which fits closer to our low option, $389 versus $434. And then for family coverage, $659 and $1,085 on the active care plan. This is our current benefit structure. We've got 3 plans, the low option, the high option, the HMO. The low option is an 80-20 plan with a $750 deductible. The high option is a 90-10 plan with a $500 deductible. And the HMO is our richest plan at 100% coverage. The pharmacy, whether you're on the low option, high option, or HMO, it's the same. It's a $15, $30, and $60 copay. And then the last line there, you've got the enrollment of 38.8% on the low option, 32.9% on the high option, and 28.3% on the HMO. This is how we spend our healthcare dollars here at Northeast. 34.2% go to the professionals. Those are your doctors and specialists. Inpatient services garner 18%. Outpatient, 19.1%. Pharmacy, 21.6%. And admin, 7.2%. The admin is what we pay to process all these claims. Now, in the past, we've talked about our RX is high, that it generally runs about 24%. That is because we hadn't included the admin. So once I added in the admin costs to give you an idea of what it's running, that lowered the percentages for the rest of the pie, and that's how we get the 21.6%. We've also talked to you about the 80-20 rule, that 20% of the claimants will drive about 80% of the claims. So I just wanted to bring this to your attention on the high-cost claimants. These are claims that exceed $30,000. They represent 2% of all claimants, and they drive about 35% of the claims. So 2% equals about 35%. So when we started this budget process in the spring, we were looking at a projected revenue for 2013 of $52 million, projected expenses of $56 million, a net loss of $4 million, and our goal was to balance the budget. So we've got some plan design changes. We did quite a few plan design changes this year in 2012. So we have just very minimal. We've got these 2 changes on the low option for this year. We're increasing the low option deductible from $750 to $1,000. That's going to increase the spread between our low option and high option. Right now, there's only a $250 difference. So that'll increase it to $500. We'll be at $500 on the high option and $1,000 on the low option. And then the other change is the co-insurance max from $3,000 to $4,000. Now, this is for 2013. Looking forward to 2014, and we're not going to cover that, but I just wanted to throw this out there. You know, we don't have a lot of changes, but I do foresee with you know, funding being so tight for the district, and we're not getting the money from the state, we will be probably looking at revamping the plans that we offer. There was an article in the paper this week where the county was revamping the plans that they offer. They're eliminating their HMO plan and redoing the way they offer their plans to their employees. So I foresee that coming up in 2014 for us.
All right.
This is the proposed increases on our premium plans. They are basically the same premiums that I showed you in May. However, in order to balance the budget, we had to increase the PPO plans $10 for each category, and the HMO $9. So we're looking at the low option. It's a $15 increase to the employee and $32 for the family. On the high option, $34 for the employee, $75 for the family. And on the HMO side, a low of $75 on the family, and the highest increase is on the employee and children at $92. What we're trying to achieve on the HMO is, since it's our richest benefit, the employees get 100% coverage. It has been historically priced lower than our high option, which only covers 90/10 and has a deductible. So we're bringing up the HMO plan on par with the premiums of the high option HMO. High option PPO, I'm sorry. Additional funding. During the budget process, the district increased their contribution by $20, so the $2.2 million has already been approved. What we're looking for tonight are the rates for the employees. That would add an additional $1.9 million for a total premium revenue of $4.1 million. So the projected revenue is 52.4. Expected funding is 56.5. That's a deficit of $4.1 million. You add up the district, the employee increases, and the benefit changes. All of those add up to $4.5 million, giving us a net income of $400,000. But we're going to see a slide here in a minute or two where that will not be an overage after all. Sorry.
Rats.
This is the same slide. It's just showing that $400,000 adding to the beginning fund balance of $2.389 million and ending with $2.789 million. We do anticipate, with the increase in premiums and the low option having the lower increase than the other plans, that there will be migration to the lower option. And when that occurs, it will have less revenue. So the revenue is estimated at 55.7, and we'll have less expenses, and those are estimated at 55.7, giving us a balanced budget. The other item that's on the agenda tonight is our TPA services. The last time we bid out was 5 years ago. 5 years have gone by really quick. We started the RFP process in April. It was a very long process. We just wrapped it up, and that's why we're bringing this to you in August instead of July. We went back and forth with the negotiations. As you can see up here, our finalists were Blue Cross, our current carrier, and Aetna on the medical side. But we also asked the carriers to give us a separate quote for our pharmacy, because we very well could have one carrier for medical and another carrier for pharmacy. And those three finalists were Blue Cross, Aetna, and Restat. On the initial proposal that we received from Blue Cross, it included a 3.8% increase with a 4 and 5% annual increase in the subsequent years. However, like I said, with negotiating back and forth, Blue Cross, we were able to negotiate a 4.5% decrease in the admin costs and get a 3-year annual max in the subsequent years. To sweeten the pot, we also got $320,000 in an annual wellness credit. So we're going to be able to continue to our wellness initiatives as we have, whether that's the screenings, the biometric screenings, the flu shots, the Naturally Slim program, and I believe there will be some additional funds in there to do some other wellness initiatives.
Steve?
Yes.
The wellness credit, that helps, because in the past we paid for it out of the health fund. We paid for the flu shots and for the screenings. With that annual wellness credit, we'll be able to charge it. We'll get reimbursed by Blue Cross to pay for those. So that was a big thing. And I have to commend Steve and Mario because they really squeezed Blue Cross at the very end. I mean, we took in the bids in April, and they've been negotiating for the last 3 months, and they were really taking their time. And with Holmes Murphy helping out, their consulting, they were able to really get this cost down.
Thank you, Dan.